Did you know that you're supposed to live 120 years? Yet most people in the U.S. die in their 60s, 70s, and 80s. Welcome to Longevity with Dr. Wilcox. For the next 60 minutes, we're going to add years to your life. The phone lines are open at 731-1230. That's 731-1230. Or toll free. 1-866-820-5528. That's 1-866-820-KLAV. Now let's bring on the host. Here is Dr.Simmon Wilcox.
Good morning. It's good to be back. Have my colleagues in the studio here, Tony and JR, Tim, the resident DJ.
Morning.
JR, you had a interesting question for me this morning.
Well, one of the clients that we had come into the office yesterday that was referred to us seemed to be doing well for himself. Businessman that worked with companies and built companies, and seems like very successful and driven. He's a little overweight. Was concerned about his blood pressure. Doesn't like the medications that he's taking for his blood pressure, the way they make him feel. So he's here to see us. He blatantly told me that he did not want to change his lifestyle. He wanted to eat pasta. He wanted to eat cheeseburgers. He wanted to eat whatever he wanted to eat. He wasn't really into working out. But he wanted to feel healthier. So I said, wow, I would like to do that too. But he ended up in our office, and the best I can see it, Doc, and I thought maybe he changed his tune when he spoke with you, is that he's trying to hedge his bet.
And he's probably representative of a large number of people that we see who I call it an Americanitis. That we want something that's simple, we want something that's fast, we want something that's painless, and we want to keep doing what we're doing. We want to keep doing things that bring pleasure to us day to day, even though we recognize that there's a long-term downside of what we're doing every day. He wants to change. I shouldn't say he wants to change. He wants to change the outcome,
right, without
changing what he does day to day. And so he's looking for an answer, and looking for an answer that his money can buy, because he was well heeled financially. That is there a way that my money can buy me a solution that allows me to keep doing my negative activity that's making me happy, and not experience any negative consequences from it at the end of the decade or 2 decades down the line. And the short answer is there's not a good way to get there. And I actually talked to this individual for almost 2 hours.
Yeah.
I think it was 8:00 last night when that person finally left. But one of the things I said to this individual, I said, let's do something that's simple. Let's reach for some low-lying grapes. Let's just begin with, because he had hypertension also, let's begin by changing the salt on your table. Can you do that for me? He said, what do you mean? I said, well, the salt that you have on your table is actually manufactured and is heated to 1,200 degrees Fahrenheit. And in that manufacturing process, in that heating process, they also put a non-caulking type of chemical in it, a chemical in it so it doesn't stick together, and then you have table salt. And so the problem with that is that in the process, it's taking out all the minerals that you need, and the fact that it doesn't allow it to stick together makes it difficult for our body to actually eliminate it. And in fact, that's why salt causes swelling. That's why salt causes high blood pressure, because the table salt that we're used to has been so manipulated that it's become a foreign body. The processing of the of the table salt has made it a weapon towards our body. And I said, so let's start here. Let's have you switch to some type of sea salt. Let's have you switch to, and we talked about Himalayan salt, because the sea salts, they've been around for over 500 years. All salt comes from the sea, or they come from some type of lake bed, but they've been around for years. And the sea salts we see on the shelves at the grocery stores have not been manipulated. If it says sea, S-E-A, salt, then it has not been manipulated. It has not been fried at 1,200 degrees Fahrenheit. It has not had all the minerals removed from it. And therefore, it's a positive. I mean, I tell patients even put it in their bath water, so it can act as a detoxifying agent. And if you're a poor cook and you sprinkle sea salt on your food, the food tastes better.
That's a secret out there.
It's a secret out there.
All you housewives out there.
Yeah, those of you who learn how to cook, buy some sea salt. Everybody will say, "Oh, it tastes so good."
So, the table salt, and I think I remember seeing on the Morton salt is ionized salt. Is that what it is?
They call it ionized salt, but they're taking the iodine out.
Okay.
So when you say ionized, they're referring to a chemical reaction that they part of the processing of it, which is a non-healthy processing. So that it helps to, as most everybody sort of knows, salt and hypertension, etc. Yes, it does give you hypertension, but if you use a sea salt, then you don't have those same side effects. Sea salt, particularly Himalayan salt, and I have no financial interest in Himalayan salt, but it has 84 minerals that we don't have access to. And as we talked about in some of our earlier shows, when we talked about longevity, there's a difference between working out and looking aesthetically well. That doesn't necessarily translate into longevity. Working out helps. It helps you look good. It probably buys you 6 to 12 months of life, but doesn't translate into 10, 20, 30-year extension. Yes, we don't want to have the obesity, but working out by itself is not the final answer for longevity. Working out in combination with nutrition, things you eat, and in combination with replacing the minerals you lose. Because those particularly who work out sweat.
Right.
And during the sweating process, we lose a lot of minerals, and particularly copper, magnesium, etc. And when you take Himalayan salt, 84 of the minerals that you lose is now being replaced. So that goes a long way towards longevity. If we use it put it on a table and remove all the ionized salt from the house, at least the kids will become accustomed to, and it actually tastes good. Accustomed to the this type of salt. I even put it in my shakes in the morning when I'm making shakes, and I think the smoothie that we experience.
The recipe, part of the recipe is a salt.
It's sea salt.
Salt. Yeah.
Put the sea salt in the smoothie, so it makes a big difference. It improves your bone strength. It improves your vascular condition. It promotes a proper pH balance of the brain, surprisingly.
Now, Doc, I got to ask you this because it sounds like it's almost magic. Is too much not good for you?
Well, yeah. I mean, you should do it with limitations. You shouldn't work on a whole box of sea salt a day. Everything is in moderation.
Right.
But you sprinkle it on. You could use it at every single meal. You don't have to worry about that side effect of it causing you to have a high blood pressure. So it's a much better road to go down. At the end of the day, it helps you in decreasing the aesthetic signs of aging, so that you look and feel younger because you're having the minerals that your body normally needs. But understand that when you take something salt, ionized salt, wastes energy. It creates a burden on your body and your body's ability to eliminate. It dehydrates, it pulls out the water out of your cells. And we're consuming, as Americans, about 5,000 milligrams of salt or the sodium chloride a day. And so if you continue with the ionized salt, it helps to facilitate the development of gout, the development of kidney stones, the development of gallbladder stones. Wow. So that and those people who complain of the cellulite, the dimply appearance of their skin, iodine salt helps to create that actually aesthetic issue that you're struggling with. So for a number of reasons, we should look at moving away from the table salt and going to the Himalayan salt. And so I told that individual that's the number one thing he can do, and he kind of shook his head. He thought he can do that because that doesn't compromise all your other activities. And he is eating, even though he said he'll think about modifying his diet, think about including more fruits and vegetables into his diet, and walking away from the ketchups and the French fries and the hamburgers. But I understood that he's an individual who's been very honest, said, I'm not going to do it. So I said, at the very least, please do this here. And so some people you have to work gradually. You have to meet them where they're at. Right. And walk with them at their own pace until they're ready for the next step. And as much as this may sound like a simple step, for a lot of people it's hard to do. They're in habits that they don't want to change. So I think we made that much mileage. We also gave him rounds of omegas yesterday, rounds of glutathione intravenous yesterday. Because if he's not going to take in the omegas himself orally, which I've asked him to do, put flax seeds, sunflower seeds, olive oil on salads, which none of that he seemed to want to buy into. I said, let me give you some of the omegas, try to help rebuild the myelin around your nerves. So I actually gave him the intravenous omegas, the glutathione, the vitamin B12, and the intravenous Myers cocktail. And because he was having an issue particularly with hypertension, we added some extra magnesium to him, because magnesium really helps to bring down the blood pressure. And most of us are walking around deficient in magnesium. And that's hard to confirm, because normally you go to the doctor and we draw blood, and the blood shows a normal magnesium, let's say. The problem is that the tissue magnesium and the magnesium level in the blood does not correlate. So even though your serum magnesium may turn out to be normal, and if your tissue magnesium is low, and for most of us is borderline low to low, that's when you get into trouble with the blood pressure. So that's one of the things that we really look forward to occurring as you make decisions in terms of changes to pick up the minerals. I gave him magnesium because he hadn't started on the Himalayan salt, but Himalayan salt has magnesium in it. So once he's on his way, that's going to fix a lot of those problems. I've seen people with mild high blood pressure become better just by adjusting the salt intake. So deleting the traditional salt, and who's ever cooking for them, they delete the iodized salt too. Because whether you put it in the food to cook with or you shake it on your food at table, either way it becomes a weapon. So to avoid having that weapon, to avoid weaponizing your salt, what we ask people to do is to move towards the Himalayan salt, which is an easy change for most people. And so we'll see when he comes back how he's feeling and how much of what we recommended for him to do that he has actually picked up on and incorporated and indoctrinated into his life.
The good news is he took the first step and came and saw us.
Well,
that's a good thing.
Yeah, he recognized that there's a problem. Yeah. 3 doctors before me told him that there's a problem, but I think they were so hard on him that he didn't want to come back. So I tried to take it the easy way and baby him, even though he's over 50 years of age. You're listening to KLAV 1230 AM, KLAV 1230 AM. Please call us at 731-1230, 731-1230.
We'll be right back.
Are you having difficulty detoxing from drugs or medication? Let Dr. Wilcox help you. Call at 702-749-7111. His revolutionary detoxing program is designed to help you detox without the discomfort of other procedures. Call him at 702-749-7111. Visit his office in Summerlin at 8751 Charleston, Suite 210 behind Fleming's Steakhouse. Call Dr. Wilcox at 702-749-7111.
Hello, my name is Dr.Simmon Wilcox. I'm a board-certified physician in family medicine. I have 20 years experience with drug and alcohol abuse and treatment thereof. I bring to you a new service at my facility. We're asking you to examine your household, your family, your community, and decide if there's someone there who needs what we have to offer.
Give Dr. Simmon Wilcox a call today at 702-749-7111.
Do you know that 60% of the healthcare dollars spent over the next 10 years will be spent on stem cells or a stem cell-related process? Listen in as we define for you how medicine will change your life and the life of those who you love over the next 10 to 15 years.
Covering the issues that matter and adding years to your life. Longevity with Dr. Wilcox. Monday and Thursday morning at 10. Only here on KLAV.
Just about 4 years ago, I was longboarding, hit the side of a truck. I'm sent home with the oxycodone and the Percocet. The dose milligram, it didn't change, but how often I would take them did. I wanted to stop. These withdrawal symptoms are something that I wish upon no one. I went to my doctor, Dr. Wilcox. He claimed withdrawal free. It was literally a miracle. I feel, I would say 100% better.
I'm Dr. Simmon Wilcox. I've been practicing medicine for the last 23 years. My passion has been drug and alcohol dependency, particularly methamphetamine. So what I've done in my practice, I've re-engineered how we approach the detox rejuvenation process. You go through a process where you don't feel any symptoms. My staff's priority is to ensure you're not having that discomfort.
Call 702-749-7111.
Longevity with Dr. Wilcox continues. Here again, your host, Dr. Simmon Wilcox.
I understand we have a caller, and the caller's name is Florence. Florence, are you there?
Yes, I am.
Hello, Florence. How are you doing today?
Just fine. I enjoy your program very, very much.
Well,
and I was wondering if you could give us some insight about taking apple cider vinegar. And I'll take my answer on the air. Thank you very much. Bye.
Okay.
All right.
Sure enough. There's a number of individuals who like to use apple cider vinegar. The apple cider vinegar is useful as a detox item, an internal cleansing item. You probably want to talk to your doctor before you try to go on any particular cleanse relative to apple cider vinegar. There are other individuals and the protocols you can find on the internet for apple cider vinegar relative to using it to treat your gallstones. And supposedly very successful. And I've never actually followed a patient who used the apple cider vinegar protocol for gallstone dissolution. It's a non-traditional way to attempt to resolve the gallstones. However, I understand from patients who claim they've done it that they tell me has worked, but I've not followed them from beginning to end. These are all anecdotal stories that patients have told me either after lectures or have come to the office. But the two biggest uses individuals who have come to me with apple cider vinegar has been as a body cleansing agent to detoxify the body, to cleanse the body, to do a bowel cleanse, as well as treating the gallstones. There was one point of clarity we needed to make on the issue of sea salts. Someone called in during the break and asked about real salt, and let me say that I support real salt. Again, I have no financial interest in it. I've used a lot of real salt. So whether you use real salt and Himalayan salt, I support both of those in terms of the switching from table salt to sea salt. Tony, you had a question there.
I did have a question. We received an email from a longtime listener, and the person in question, they have hepatitis D, and they wanted to know what is the best course of action for their situation.
Hepatitis D. A lot of people aren't aware that there are more than the basic hepatitis A, which I'm kind of Often we refer to as food handlers, the disease that can pass from hand to mouth. Hepatitis B, which a lot of us have heard about, usually for the most part, B and D tends to self-correct and self-cure themselves. I'm sorry, A and B tends to self-correct and cure themselves. Hepatitis C has a subset where they can become chronic, and we've treated and we was involved in some research with hepatitis C back in Pittsburgh. And it was we would actually go surprisingly to the nightclubs. At 12 midnight, we would pay the DJ. We would meet him a couple of days before. We would give him $100. He would turn on the lights. We would make an announcement, and we would draw blood. So we went to clubs for the better part of 5 months drawing blood, and clubs that we thought would have a high rate of people with hepatitis C. And so we know a lot about hepatitis C. We've treated a lot of hepatitis C. One of the treatments happens to be our intravenous glutathione. There's interferon treatments. And they're out there as well as some others. So we treat a lot of hepatitis over our lifetime here as a physician. But hepatitis D is something that we don't hear a lot about. It tends to occur more both D and E, and we don't hear a lot about. Hepatitis, they do exist, and they tend not to occur a lot in America. They tend to occur more often in warmer climates, more tropical climates, and tropical countries. By themselves, they tend to be short-lived. If you happen to be unfortunate and have hepatitis C and then catch hepatitis D, you got a problem because it makes the hepatitis C more virulent, more aggressive, more likely to move towards a course of liver failure and then also cirrhosis and liver cancer. So if you have D or E, and then you unfortunately already have had hepatitis C and you're a chronic hepatitis C carrier or chronically infected with hepatitis C, and you happen to catch one of the other ones, you've created a problem. And it's really, you're just going to take a team of people to address it and try to resolve that issue. I'm not really sure exactly what the emailer's position was in terms of what their health status happened to be, whether they had hepatitis D by itself or whether they had it in conjunction with hepatitis C. I would gather that if they're from the United States, they probably was out on vacation and traveling somewhere else in some tropical environment and unfortunately caught the hepatitis D and brought that back home. What we often, the question actually that came up yesterday morning by another client was the issue of herpes. And that particular client was asking a question about the presence of herpes as well as the hepatitis C concurrently. And what was interesting, Tony, as I try to Google some scientific details, we saw that there was a number of dating sites on the internet that were exclusive for people who was unfortunately caught with these chronic issues, chronic hepatitis C, HIV, and as well as the herpes. But just like many individuals have not heard about hepatitis D and E, many individuals are unaware there are 7 or 8 different types of herpes. I believe that JR, the person asked you a question they
asked about the herpes and they wanted to know really how it was passed. And we know it's I guess I always thought herpes was sexual activity, intercourse, but can you also get herpes from oral sex?
And the short answer is yes. And because of the oral sex activity, now that we typically would perceive herpes type 2, which was typically the genital herpes, can be passed orally from kissing or from oral sex and vice versa, so that the 1 and 2 can occur from the lips, or 1 and 2 can occur from the genital area. When you look at the cell type of the mouth and the cell type of the genital area, it's something called squamous cells. You have the same exact cell type, so therefore it's easier to catch it through the skin, because the skin is very moist, very soft, and easier to tear. And that's why when you look at the whole hepatic issue, if an individual has had sex with four people or less, they have a 4% chance of developing herpes. If an individual has sex with more than 10, they have a 30% chance of walking around with herpes. And a lot of the herpes event, particularly the herpes 2, a lot of that is asymptomatic. So it's saying that 80% of people with herpes type 2 do not know they have it. Therefore, they're not in a position to communicate that to their significant others or to their sexual partner. And so even now in 2014, as sophisticated as we are, herpes runs rampant. We have not been able to really gather the type of social control over it. And education doesn't seem to have made a difference, so we need to find a new paradigm in terms of how we communicate, because it's really that 19-year-old, I should take it back, that 14-year-old to 49-year-old age group where we're seeing the predominance of new cases occurring in herpes in this country. And we have not figured out how to communicate to whether to the 14-year-olds or the 49-year-olds in a way that they change their activities, because some of these items like the herpes type 2, we have no good way of resolving it. We have a treatment in the office on the alternative side of the equation for it. And people have said to me, what do I do with my partner who doesn't have that particular infection? And honestly, they just need to communicate with them, and they unfortunately have to practice safe sex, even during the marriage, and try not to pass that on to their loved one until they've responded to one of the treatment modalities that are out there. But you can really get into a long, drawn out medical treatment, trying to resolve that particular activity. There was another question that I think Tony had relative to the herpes, actually.
Since you brought up the topic, it seems to be baby fever around my wife's workplace.
Baby fever, okay. I was like, what is baby fever? What infection is that? Okay.
So anyway, that being said, is there any chance of a miscarriage if someone has herpes?
Yeah, the short answer is we don't see a lot of it, but in theory, in that first trimester, the most sensitive part of the pregnancy, if you get an outbreak, an outbreak can lead to a miscarriage in that first trimester, particularly a bad outbreak. So there are consequences to having it during the pregnancy. Even, and I probably should have said, even though I suggested earlier that hepatitis B and E were things that were short-term, not chronic unless it was associated with hepatitis C. The reality is that if you're pregnant and you get hepatitis D or hepatitis E, you can really get into trouble. And the same thing here, if you're pregnant and you have herpes type 2, the fetus can really get into trouble, particularly in the first trimester. So you're listening to KLAV 1230 AM, KLAV 1230 AM. Please call us at 731-1230, 731-1230.
We'll be right back.
Just about 4 years ago, I was longboarding, hit the side of a truck. I'm sent home with the oxycodone and the Percocet. The dose milligram, it didn't change, but how often I would take them did. I wanted to stop. These withdrawal symptoms are something that I wish upon no one. I went to my doctor, Dr. Wilcox. He claimed withdrawal free. It was literally a miracle. I feel, I would say 100% better.
I'm Dr.Simmon Wilcox. I've been practicing medicine for the last 23 years. My passion has been drug and alcohol dependency, particularly methamphetamine. So what I've done in my practice, I've re-engineered how we approach the detox rejuvenation process. You go through a process where you don't feel any symptoms. My staff's priority is to ensure you're not having that discomfort.
Call 702-749-7111.
Do you know that 60% of the healthcare dollars spent over the next 10 years will be spent on stem cells or a stem cell related process? Listen in as we define for you how medicine will change your life and the life of those who you love over the next 10 to 15 years.
Covering the issues that matter and adding years to your life. Longevity with Dr. Wilcox. Monday and Thursday morning at 10. Only here on KLAV.
Are you having difficulty detoxing from drugs or medication? Let Dr. Wilcox help you. Call at 702-749-7111. His revolutionary detoxing program is designed to help you detox without the discomfort of other procedures. Call him at 702-749-7111. Visit his office in Summerlin at 8751 Charleston, Suite 210 behind Fleming Steakhouse. Call Dr. Wilcox at 702-749-7111.
Hello, my name is Dr.Simmon Wilcox. I'm a board-certified physician in family medicine. I have 20 years experience with drug and alcohol abuse and treatment thereof. I bring to you a new service at my facility. We're asking you to examine your household, your family, your community, and decide if there's someone there who needs what we have to offer.
Give Dr. Simmon Wilcox a call today at 702-749-7111.
You're listening to Longevity with Dr. Wilcox. The phone lines are open at 731-1230. Now, here again, your host, Dr. Wilcox.
We're back at the bottom half of the hour. JR, you see the question there?
Yeah, I was curious if you could clarify the different types of herpes.
As I kind of alluded to earlier, there's 7 or 8 different types out there. Type 1 is the one we normally are used to. Everyone's familiar with the cold sores. And what I tell my patient with the cold sores is that if you just go by, particularly those who have constantly reoccurring cold sores, if you just go by over-the-counter lysine, lysine goes a long way to abbreviating the breakout in the first 24 hours. If you just go take over the counter, take 2 of those pills twice a day for the first 2 days, it goes a long way to abbreviating the breakout of herpes 1. Herpes type 2 is particularly perceived as the genital herpes. And that's the one that is, if you have it and you're an active lesion at the time of pregnancy, they don't want to deliver the baby because they're afraid that the baby may catch something and they have to do a C-section, but they won't deliver the baby vaginally when you have active herpes type 2 infection. The problem is that even when you don't have an active outbreak of herpes type 2, you are still shedding the virus, so that you can spread it even when you don't have an active outbreak. And that's the difficulty and one of the reasons why at a social level we have not been able to really gain control of it, because individuals don't know that they're still shedding or recognize that they're still shedding even when they're not having an outbreak. If they have an outbreak and having pain, they tend to abstain from sexual activity. But the issue is you don't know when you're shedding, particularly when you're not having an outbreak, to give you a clue that something is transpiring there. Then there's the herpes type 3. And most of us have had type 3 because most of us have had chickenpox. And chickenpox is, in fact, herpes type 3. In the older population, I guess I'm 57, so I'm in that population, we tend to get zosters and we call it shingles, the breakouts, the painful breakouts along the rib cage and along your back. And then we have to address that actually with a cyclovir, which is medicine you take by mouth. And you have to catch it earlier, because if you catch it too late, you can get something called post-herpetic neuralgia, which is this painful, debilitating discomfort that occurs and can stay with you for months afterwards. But the problem is, once we have chickenpox as a young adult, that virus stays in your body. It hides in a nerve ending. And then under stress, whether that's emotional stress, financial stress, severe changes in weather, it breaks back out again. And so there are treatments for that. These cyclovir prescribed by the physician. For those who don't respond to that, we have, since it's a neuropathy kind of pain, we do give the intravenous omegas and the intravenous glutathione for that neuropathic, that neuropathy type of pain associated with the post-herpetic breakout. called shingles, which is a byproduct of the chickenpox you had when you was younger. There's also herpes type 4.
Wow.
There's lots of them out there. Herpes type 4, and most of us have heard of an infectious mononucleosis mono. That's really a herpes. And that can be contagious as well, as you know, particularly by kissing, sneezing and coughing, and shaking hands with someone who has the mono. It can be infected, but mono is a type of herpes. It's herpes type 4, and a lot of us don't associate the two. We don't put the two together in the same class. When we look at herpes, I'm sorry, there's a question.
Question for you. I had somebody that a friend of mine was taking a nitric oxide product, NO2.
Okay.
Which is mostly made out of, I believe, arginine. And they couldn't take it anymore because they would develop cold sores by taking, because there's large doses of it. And it's a I know you know what it is, but it's a supplement for working out. But and that is that different things that will irritate or bring the herpes symptom up.
Different strokes for different folks. Individuals' DNA is going to determine what you're predisposed to in terms of what will be your ultimate triggering factor. Yes, stress. Yes, weather, as you talked about. Yes, severe illnesses. But for some people, it's what they eat. Okay. And for this particular individual, it sounded like the arginine was a contributing factor. And that's not typical. But it's not unheard of. Okay. That something like arginine could be the triggering factor for that particular individual.
Huh, okay.
Absolutely. So we talked about herpes 5. There's a herpes 6 out there. The herpes 6 happens to our young kids. That's something kids get, this little red cherry type cheeks called roseola.
Right.
That's actually herpes 6, and that tends to be self-limiting. And will correct itself. We have a question there. Sheila has called in to me. Hold on the other two types, and we'll take the phone call from Sheila. Sheila, are you there?
Yes, I am. Good morning. I wanted to find out, what do you think about juicing for weight loss? And I'll take my answer on the air as well.
Hello, Sheila? Sheila?
Yes.
Okay. Just let me just clarify. Are you juicing at all right now?
Yes. Well, I do smoothies.
Okay.
So I'm trying to see, because I do eat more plant-based foods and all of that. And I don't.
Would you mind sharing with us what you put into your smoothie now?
Like cilantro.
Okay.
Cilantro. This morning, like, I had cilantro, apples.
Okay.
Cranberries.
Okay. Very good. Very good. You're on.
And
Go ahead.
And I also like. I don't know if protein powder is good. I use pea protein powder.
And that's excellent. I like pea protein powder. I like cranberry protein powder. I like rice protein powder to add to your shake. So you're absolutely on the right track. I would say that one of the great things to put in a smoothie are beets. And it's difficult for me when I do beets. So I have to figure out how to cover up the taste of the beets. I'm like the little kid who just doesn't want to eat it because it doesn't taste good. But just beets, the kales, the greeneries you put inside. But you have to work at, how do you ingest it in a way so the taste is right. I'll put flaxseed in my smoothies in the morning. I'll put coconut oil in my smoothie in the morning. And then I'll turn around and I'll place some organic honey in to try to fix the taste of it. We can use some vanilla extract to fix the taste of it. Often I would use almond milk inside the smoothie to try to give it some volume along with some ice. So those are some kinds of things, and you may want to alter it from one day to the next. Sometimes I put too much in, and I find myself feeling nauseous. So I have to back off myself. So I would say that each.
What about stevia? What about stevia? I put that in my smoothie.
Okay, and stevia is probably one of the few sweeteners that I'm okay with. I'm okay with stevia. It's one of the few sweeteners that I'm okay with. Sometimes I use dates in my smoothie to try to give it that sort of better taste, that nice some sense of a sweet taste to it. But stevia is fine. But dates, 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 they are also fine. But again, don't be like me, because sometimes I overdo it. I get overzealous and I put too much in, and then it gives me a bad morning when I go to work, because my stomach is aching because I've overdone the smoothie. So I try to adjust and put different things in on different days. But try the beets, try the different greens, and look at the different items you may put in to try to adjust for the taste of it. The protein is great. We would prefer, like you said, I'm not sure who taught you that, but it's great to hear that you're using pea protein or rice protein or cranberry protein as opposed to some other protein products out there. I use a lot of something called Sun Warrior. It's made here locally in Nevada. It's probably the #1 protein mix in the world. I happened to go to the office one day about a year and a half ago and heard all these ladies behind the wall, about 200 of them, and they had a telephone call center taking orders from all around the world, mostly from Japan, for their orders of Sun Warrior, probably the best protein product out there. Thank you for your phone call.
But I had another question, but can you address, and I'll take it on the air, can you address juicing? Because what I'm interested in doing is trying to lose weight, and with the smoothies, I haven't been losing weight. So I wanted to find out your opinion about juicing as opposed to doing the smoothies, and I'll take my answer on there. Thank you so much, Doctor.
Thank you for calling. Thank you for the inquiry. Juicing is great. But it's easy to say juicing is great, but doing it is something else. Individuals have to become used to the juicing process. So whether you're juicing the fruits, I like for you to use the entire fruit, the rind of the oranges, the pills off the apples. And so you have to work at buying a blender that's able to deliver all of that to you and not discard some of the best part of the fruit, some of the best part of the vegetables is the outer shell. So what you want to do is make sure you do not discard that outer shell. But otherwise, the juicing, like the smoothies you make in the morning, are going to be very good for you. Your body's able to assimilate it better. Each one of us have to decide in our own way, how do we adjust it in a way that makes it palatable for our taste buds? Because we all have different approaches in terms of what we like to eat and what tastes that we're able to really tolerate going forward. But again, thank you for that inquiry. We welcome all the calls. Let's move back to the subject we was almost finished completing just before the call came in, and it was that on herpes, and we was looking at the subject of the different types of herpes out there, and I think we left off with herpes type 6, which was it presents as a high fever and a rash in our young adults. It's something we call roseola. And then there's and that typically sometimes even associated with seizures in our young adults, but the seizures is a febrile seizure only related to when the kid spikes a temperature. And it's self-limiting, it goes away. Then there's herpes type 7, which we have learned that probably occurs in conjunction with herpes type 6 in our young adults. And again, that tends to be self-limiting and goes away after that event and doesn't seem to really reappear, the best we can judge, in the adult life the way the herpes type 3 reappears. And then lastly, there's the herpes virus type 8. That can be more lethal It's associated with something called Kaposi sarcoma, which we see with our patients, elderly population. And in a young population, we see it if they have AIDS. In an elderly population, we see it when they have a compromised immune system. It's herpes type 8, and it's called Kaposi sarcoma. You're listening to KLAV, station 1230, KLAV, station 1230 AM.
We'll be right back.
Just about 4 years ago, I was longboarding, hit the side of a truck. I'm sent home with the oxycodone and the Percocet. The dose milligram, it didn't change, but how often I would take them did. I wanted to stop. These withdrawal symptoms are something that I wish upon no one. I went to my doctor, Dr. Wilcox. He claimed withdrawal free. It was literally a miracle. I feel, I would say 100% better.
I'm Dr.Simmon Wilcox. I've been practicing medicine for the last 23 years. My passion has been drug and alcohol dependency, particularly methamphetamine. So what I've done in my practice, I've re-engineered how we approach the detox rejuvenation process. You go through a process where you don't feel any symptoms. My staff's priority is to ensure you're not having that discomfort.
Call 702-749-7111.
Do you know that 60% of the healthcare dollars spent over the next 10 years will be spent on stem cells or a stem cell related process? Listen in as we define for you how medicine will change your life and the life of those who you love over the next 10 to 15 years.
Covering the issues that matter and adding years to your life. Longevity with Dr. Wilcox. Monday and Thursday morning at 10. Only here on KLAV.
Are you having difficulty detoxing from drugs or medication? Let Dr. Wilcox help you. Call at 702-749-7111. His revolutionary detoxing program is designed to help you detox without the discomfort of other procedures. Call him at 702-749-7111. Visit his office in Summerlin at 8751 Charleston, Suite 210 behind Fleming Steakhouse. Call Dr. Wilcox at 702-749-7111.
Hello, my name is Dr. Simmon Wilcox. I'm a board-certified physician in family medicine. I have 20 years' experience with drug and alcohol abuse and treatment thereof. I bring to you a new service at my facility. We're asking you to examine your household, your family, your community, and decide if there's someone there who needs what we have to offer.
Give Dr. Simmon Wilcox a call today at 702-749-7111.
Today is the first day of the rest of your life. This is Longevity with Dr. Wilcox.
We're back.
We're back. Thank you, Joe. We're back at the bottom of the hour.
Yes, we are.
Yes.
You know, Doc, herpes and hepatitis.
Yeah.
You know, these are things that I hear about. I haven't seen personally, thank God. But for our listeners out there, what do we do? And what are the things like our glutathione? I know it's the mother of all antioxidants. Mm-hmm. How could that help treat those?
Well, glutathione is probably the most powerful item out there from a natural format to clearing most to all liver issues. For example, if you go to the emergency room and you happen to have taken unfortunate excess amount of Tylenol, they give you something called mucimist. Mucimist actually breaks down into glutathione because it's powerful antioxidant. It has saved so many people's lives, but you have to administer within X amount of hours, usually within 2 or 3 hours of the overdose of Tylenol for it to be effective. But it speaks to the power of glutathione, and every emergency room in the country uses it to try to salvage the liver from the toxicities of excess Tylenol in this country. And I believe in one of our earlier shows we did a show about the excess Tylenol people consume.
Yeah.
So that speaks to the beauty of it. And what we've seen in the practice of individuals have come in, individuals told they were needed liver transplants, to individuals who had yellow eyes from the hepatitis, individuals whose blood tests were markedly abnormal from the infection, and then after usually 2 to 3 treatments, the blood tests revert back to normal. The eyes are no longer yellow. The liver is still an issue, but the liver is functioning better. And those individuals, some of those who needed a liver transplant, we were able to buy them more time until they found the right liver appropriate for their phenotype, for their DNA. But it helps to buy them time. But those who are not at a stage, those who simply have an acute infection with any of the hepatitis, do very well with our treatment, particularly with the glutathione. And we always throw in the omegas, because the omegas help the immune system to keep those in check. For those who happen to have the herpes and the herpes outbreak, it's really about quieting down the immune system to put that flare in check. And we use more of the omegas intravenously to quiet that down, to help support the immune system, to help to break out. Because most of the herpes viruses like to live along the nerves. And if we can reinforce that nerve, give it the recoating that myelin sheet on the nerves, it goes a long way to quieting down the pain associated with the herpes and quieting down the flare of the herpes. So from both of those standpoints, it goes a significant way in terms of resolving that. Because what we realize is that over 25% of the population in the United States will be introduced to some type of herpetic event, and that's not including the herpes for the chickenpox, because herpes type 3 is probably 80% of the population in terms of those having chickenpox. But deleting the chickenpox event from it, over 25% of the population will be exposed at some point to some type of herpetic event, and some of those will go on and become chronic issues, and they need somebody on board to actually resolve that.
You know, Doc, I know you've been an emergency room doctor for quite some time. When somebody comes in with those type of treatments, like the overdose on the Tylenol and things like that, how do you give them the glutathione? In what form?
Well, it could be usually IV.
Okay.
When we give it IV in the office, it's a special type of inhalation treatment you can do. But often we do it IV, and we do it IV in the office. There's no real downside to it. There's no real side effects. It's just your time that you need to spend receiving the treatment. It doesn't make you sick. It doesn't make you nauseous. You pretty much are able to sit and carry on a conversation with your friends and relatives who are visiting. And before you know it, an hour and a half later, you're done. Unfortunately, you usually have to admit them because you have to repeat the treatment several times when it's acute, like for Tylenol toxicity. But in the office, for those who are treating with liver issues that are not related to the Tylenol, we're able to treat them usually every other day for 3 or 4 days to resolve their issue. And then they move on. They may come back for a tune-up, per se,
right,
in 4 or 5 weeks. But
that's just about, what, a half an hour?
Exactly. Like about a half an hour. And then it's taken care of. But you have to be proactive. You have to want to get yourself treated. You will have to want to get it resolved.
You know, unfortunately, what I see in America today, and talking to people that have come through our place, they don't want to do anything until it's too late, until they got a problem. They don't do a preventative type thing. And the Ferrari's breaking. If it breaks down, it costs a lot more to fix, and your body's a Ferrari.
Exactly. Thank you for listening to our show today. You're listening to KLAV 1230, KLAV 1230. We appreciate the phone calls. We actually continue with your phone calls. We take all questions, all compliments, and all complaints. Please feel free to call. We'll be back on Thursday.